Fabulous. Right, I think the floodgates have stopped for now, so we may get a few more people come in. Hello, my name is Jenny Norman. I am one of the advisors here at Health Innovation East and have been helping to set up this webinar. It's lovely to see you all here. I'll be letting people in and out of the meeting as we go. Hopefully the link should work for you all. I'm just going to share the agenda and a little bit of housekeeping. So just to let you know, this event is being recorded. It's being recorded right now. The speakers should be visible on the screen. They may switch their cameras off if they're presenting, just to allow bandwidth. The contact information with speakers, etc., and the CSU, the team that have been involved in supporting us with this, will be shared post-event should you have any further queries. And there is a Q&A session at the end of the webinar, but there should also be a Q&A option for you at the top of the screen. So do put any queries in there. If we can get round to it in a timely manner during the discussions, then we will. If not, we will bring it up at the end. And we will share any of this with the CSU team involved, just in case there's anything we can't answer whilst on the webinar. So this is today's agenda. We're going to have a very short introduction from Piers Ricketts, who has joined us on the call today, our CEO. Then Jez is going to talk to us from the CSU team, and then we are going to talk through our case studies. So we have one from Luton Council, and Suleiman's here to talk to us about that. Beacon House with Michelle. And Southwark Council, Denise McLagan will be joining us to talk about that. And as promised, a short Q&A session at the end. So I will end the slideshow now so that you don't have to see my awful slides. And I will pass over quickly to Piers and we will crack on with our webinar. So thank you all.
Thanks very much, Jenny. Good morning, everyone. Very nice to see you all. Just check, Jenny, can you hear me all right? Give me a thumbs up. Okay, brilliant. Thank you. So really happy to be here. Welcome to colleagues from CSU and also those of you who have joined. So our relationship with CSU goes back to June last year at the NHS Confed Expo, big conference in Manchester, where there's this huge sort of trade show full of all sorts of promising and indeed less promising tech that you can try out. CSU were one of the 20 or so innovators chosen for the AHSN network stand. And as you do, sort of in between having a coffee, I sort of went up and tried it, thought this is quite fun. You know, it takes you your weight, your height, your heart rate, various other things like that. A nice way of doing it. And of course, you immediately start thinking, well, of course, how can that be used? And Samantha, the chief exec, came up and we had a talk and passed it down to the team when I got back. And you know, this is something which is at a different end from sort of the interesting, you know, the very, very high-tech things that sometimes we look at in whether it's genomics or cardiovascular disease prevention, whatever it is. But in terms of population health, has at least as important a role to play as some of those more tech-focused or life sciences-focused things. So we're going to hear about 3 really good case studies where the device has been used in very interesting settings to help people become more aware of their health, interact with the health system, particularly in communities where people don't necessarily do that, where community attitudes and focus are different. So I'm really delighted that we'd able to work with Jez and Samantha and colleagues over the last year or so, and really looking forward to hearing more about the case studies as we go through the webinar. So I think next up, it's over to Jez, who's going to give a bit of an overview of the company and what you do and what you've done over the last year or so.
Brilliant, thanks, Piers. I'll share screen. So, very, very short, I guess, overview of the of what we do. I guess we take a bit of a holistic view in terms of what the journey is, both for the people that are helping digital platforms. We take a view around the fact that we need to work around initially how we engage with people, how we can get people to do health checks in a variety of locations. And to date, and we've been working in the UK for about 7 or 8 years. We also have a presence internationally as well. But within the UK, we've completed over 870,000 health checks. And we do a lot of work around that engagement, and it's really important to us that we're engaging with as many people across the population as possible. And we've got some great evidence to suggest that lots of people use the health station regardless of ethnicity or IMD status and a whole host of other factors. So that engagement piece, we do lots and lots of work around that, and the platform is absolutely geared towards getting as many people doing health checks as possible. The next aspect where we really focus on is around, I guess, education around health. So we can get people doing health checks that might not ordinarily do so. And it's a really good opportunity for us to get people thinking about their health that they may not already do. And we do a lot of survey work as well. One of the key numbers that we're very proud of is the fact that around 36% of people who complete a health check were made aware of the risk that they weren't aware of, obviously. And then the next aspect for us is around then how we get empower people and how we get them to actually do something about those health risks that are identified. So you can see there, 72% of people have indicated they were motivated to make changes. Really, really important to us. And a lot of the work we've done with our different partners, Luton, Southwark, and obviously with Beacon House as well, is around how we can, what do we do next? Suleiman, particularly with Luton, will talk about the pathways that we've built in that particular area. And as a good number there is around 25% of people opt in and refer themselves into relevant pathways. Suleiman will bring that to life a little bit later. And then we look at all of this, we analyse it, we look at how we can drive improvement. One of our key numbers is the fact that around 23% of people who registered an at-risk blood pressure measurement went on to improve it to a healthy level. So in terms of the platform itself, we have two key components. One component's already in prevalent use, which is the big health station, the MAX as we describe it here. And then we also have a new piece of kit which is coming to market early next year, which is our mini version, which can be transported very easily. The Max Health Station is a medical device, measures a whole range of different aspects, but it's also very, very customizable. And we're introducing new surveys, new risk assessments. On our roadmap, for instance, we have the Leicester Diabetes Risk Score, which is used by Diabetes UK. And that will be available and be able to be built into various pathways. We're also connecting with other devices. We're building a pathology offer. And obviously, part of that is working towards this sort of digital version of the NHS Health Check. One of the most important aspects of what we do is the fact that this all connects in digitally as well. We often talk about the fact that we can do the physical health check and then take people into the online world as well. And that's where we can start to look at behaviour change and how we can get some improvement. And there's a whole load of neat things that you can do on the digital platforms. And a lot of the work we're doing on our roadmap is around driving reward and gamification and looking at how we can get people to interact between the physical and the online world. We're also able to communicate and we can be very, very specific in our communications, whether that be email or potentially text in the future as well. And that can be customised according to what we're looking to do in terms of building a pathway or in terms of education. We've worked on a number of campaigns with different partners, done a good Know Your Numbers campaign with Buckinghamshire Council recently. And I mentioned around the pathways, and again, the guys will talk about this shortly. We're able to customise the station. We have something we call a practitioner portal, which allows a third party to look at, assuming people giving consent, of course, to look at the data and look at moving people into very specific, very, very local pathways. And then finally, that leads us into, I guess, the data and the insights that we're able to provide you as partners and looking at population health. And we're often able to provide some insights which might not ordinarily be available. So that's a little bit of a very, very quick overview. Very conscious we're keen to sort of get on to hear about the case studies. But I thought I'd just show or play a quick video, which was an excerpt from the BBC News where they went to see the vaccination hub in Luton, where we had a health station, and it was sort of key component of the experience. Members of the public were able to walk in on the high street and get a health check on the health station and talk about some other things. So just very quickly show this video. And what I will need to do is I'm just going to stop sharing for a moment and share with some sound, which would be good. So hopefully you'll be able to hear this.
Now, staying with health, we know how tricky it can be to get an appointment with a GP at the moment, but in Luton, a wellbeing hub has been set up to help. It's offering health checks, also vaccinations. Our reporter Andy Holmes has been along to take a look.
Gloria didn't know this hub existed. After walking in for a free health check, she's glad she's done that.
You need to get that changed. Yes, because that is seriously hard. Well, I've been told a lot of things from the result that I have seen. I'm a bit worried now, and I'm happy that I have done this because at least it tells me exactly what I have to do for myself now and be able to monitor my weight and to prevent from having diabetes and stuff like that. So I'm very happy that I have done this.
The hub's on the site of the old post office in the mall shopping centre. For a while, it was home to a COVID vaccination centre. At this hub, you can get your blood pressure taken, you can get advice on weight control, you can get your COVID and flu jabs, and also get your child's medical records updated.
Areas of work that we do here is around really encouraging people to stop smoking.
Although this hub won't replace GP surgeries, it does have clear benefits.
What we've identified, especially in the Luton area, is that people don't often like to do bookable appointments. So actually being able to just walk in, but also answer those questions and those queries that people have, either around childhood vaccinations or adult vaccinations, we're here to try and offer that help.
Since the hub opened last month, more than 300 people like Gloria have had a health check. Around 10% of those have been referred as a result.
We know that in order to support people going forward, we need to try and prevent a lot of the healthcare issues. So identifying early high blood pressure is a really good step to try and sort that out. We've also got another hub open up in Milton Keynes, and in our other areas we are looking at, what is right for each system. So it's really working with our system partners to say what would work with the demographics, with the health inequalities, and what would be right for that area.
Health bosses say vaccination uptake, and not just the COVID jab, has always been lower in Luton because of the town's higher deprivation, diverse community and population churn. It's hoped this hub will help to change that. Andy Holmes, BBC Look East.
That leads rather nicely into Suleiman to talk about the work in Luton.
Great, thanks very much, Jez. Hi everyone, my name's Suleiman Rafiq. I'm a public health principal here at Luton Council. And the reason I'm saying that really slowly is because I just want to bring my slides up. So hopefully you can see my slides. Please do shout if you can't. So I've just been asked to really give a perspective from a local authority public health experience. So I've been working in public health for around 15 years, particularly in this kind of cardiovascular disease space, NHS health checks, etc. And I'll come on to that in a bit more detail shortly. But just for anyone who hasn't had the opportunity, hasn't been fortunate enough to visit Luton, we're a very interesting town. Super diverse, I think, is a commonly used phrase in terms of explaining our population as well. You can see over 150 different languages and dialects are spoken across the town, and we're quite a young town in comparison to the rest of the region and the country. Of course, it wouldn't be a public health presentation if I didn't try and put in loads of data, so I had to do that. And you can see here in terms of our JSNA that we've tried to make a little bit more user-friendly. But as Piers said at the beginning there, I think it's fair to recognise that Luton does struggle with some of the health outcomes that we're seeing, and also engagement with our population on some of the things that are more preventable. And you can see at the bottom, one of the things I've pulled out is around 9% of under 75s in Luton died from CVD, which has been considered preventable. So a lot of really important work to be doing in regards to improving the health outcomes for the population that we serve. And so we've got different ways of doing that in regards to the cardiovascular disease prevention agenda. One of the big things that we're really proud of is our new tobacco-free Luton strategy, and obviously there's been the recent government announcement around the changes around tobacco, etc., which is a really exciting time to finally eradicate smoking. So that's fantastic. NHS health checks, as I said, Luton many years ago was one of the first areas. We often are one of the first areas in the east of England to be asked to do things for obvious reasons. And we've been delivering that programme now for a long time, and it's one of our statutory services that we deliver. And more recently, we've had the introduction of the CSU health stations. And I would just like to say, unfortunately, my colleague Christina Gleeson couldn't be here today, but it's really been Christina that's driven this work. And, massive thank you to Jez and the rest of the team for really making this one of the easiest projects that we've been able to deliver quite quickly locally for us in Luton. So this is an example of some of the promotion that we've been doing locally. As Jez says, this has been phenomenally successful. We've had, I think it's over 25,000 now uses of the machine, which, given in Luton we really do struggle getting engagement with NHS health checks and other types of cancer screening programs, for example. This has really been an example of a success story, I feel, and in part that's due to some of the learning we've had from the vaccinations, which, as you saw in the video, we've been closely working on, and really understanding why our population, what our population needs. And the 3 C's model is something that I think I've definitely taken away from the vaccination experience around how important convenience is. So, not making an appointment, as Sarah mentioned in the video, but just being able to rock up and use the machine there and then. The convenience as well in regards to the locations of the machine, so in our areas of highest deprivation, etc. The feedback we've had is people are very confident in regards to the results that are coming from the machine. It feels like it's a sturdy piece of kit, essentially, in terms of what's being fed back to the residents as well. And then finally, complacency. So often we hear, I was meant to get around to that. So, I was meant to get around to my cancer screening appointment. I was meant to get around to whatever it might be, whatever the intervention may be. But actually, because this is just so easy and in such great locations, we've really tried to tackle the complacency factor as much as we possibly can. Again, more data. I won't kind of dwell on this, but it's really powerful stuff. And I think particularly where we've struggled, as an example, is engaging men traditionally, particularly with NHS health checks. Actually, with the CSU machines, we're seeing it's slightly more men than women, but definitely much more equal footing in regards to that. The other thing I think is particularly important as well is with age. So when we were talking about cardiovascular disease that is preventable, obviously the NHS health check program, you can't have a health check until you're 40 years old, but this is fantastic in being able to pick up our younger population as well, and then being able to benefit from this intervention essentially. And again, this goes on to kind of provide more information around that, particularly as you can see the 35 to 44 age range, really strong numbers in that group, a group traditionally we've struggled to get hold of, that kind of working age group particularly have come forward in regards to this. And then you can see here, and this is again part of the good support you get with the CSU machines is around the data extracts you get. Really easy to view, very visual as well, and again just providing that reassurance around the machines that we aren't just engaging the worried well, but actually you're seeing a lot of people here with very high and severe blood pressures as an example. I had to, just to prove that I'm not on the CSU payroll, put in that actually, although this project from my perspective has been a phenomenal success, and rightly we should be proud of it, and the system has really come together, and a huge thank you to our ICB colleagues, pharmacy colleagues, etc. We've really come together on this. But the elephant in the room, as you can see on here, really for us has been the question around, okay, you're getting all of these people to have these checks, but how is that data then flowing into the GP system? And currently where we're at, we aren't able to make that happen. And I know there's a lot of work going on in the background around trying to make that happen, so that then we can work better as an integrated care system, so that then when people are accessing these checks on the high street and in other places, that then that information is coming through. So I don't feel it should overshadow the work that's been done to date, but it is very much something that's been raised to us as a challenge to try and take forward, and we're very keen to do that, working in partnership. A huge bonus for us has been the practitioner portal. So in Luton, we're very fortunate to have an integrated wellbeing service. So all of our healthy life services, smoking, social prescription, exercise referral, etc., they all sit within one provider, within one contract called Total Wellbeing Luton, and Talking Therapy sits within that as well. So they've been able to really benefit from this practitioner portal. Essentially, it's customer generation for them. So they're getting, the right people coming through to them, highlighted, triggered by the health risks, and then they're able to contact those people to provide further support. And particularly from a public health perspective, the question is always, so what? You can get people to use the machine, fantastic, but then what happens next? So being able to benefit from the integrated wellbeing service, that those then referrals are handled there, is really great. A common question we're asked about is the pathways. I've just shared that here on the screen. And I think this is particularly where our NHS ICB colleagues have been really supportive in identifying some of the national pathways as well, so that then we can have a really robust approach to hypertension detection. So huge thank you to Chirag and Matt, etc., within the ICB and colleagues who've really helped us deliver this, so that we've got that assurance around the pathway particularly. As I mentioned, and this is just what you'll see on the screen if you were to use the machines in Luton, is this opt-in approach. And as Jez said before, really high numbers of people who are opting in to get that additional support. So that's really benefiting then our total wellbeing service. And particularly if we use an example of smoking cessation, as the prevalence numbers are getting lower and lower, obviously getting those people to come forward to quit is harder and harder. So this has been a really great boost to be able to, find more people to be able to come forward for smoking cessation, as you can see. As I mentioned, and as you've seen on the pathway, a common question we're asked around is, well, what happens if the blood pressure is high or very high? So these are the screens that you'll see in that case. Similarly, when it's severe, and we see a lot of that, as we saw with Gloria in the video, we see a lot of people who are being identified and they need to have immediate intervention. And realistically, I'm pretty confident we've saved a lot of lives from these machines. So for people to be able to then recognise, actually, I need immediate support, and then be able to access that has been really fantastic to see locally. So sorry, in conclusion, is, as I've said, I think, for us, for Luton, the population that we serve, a younger population, a highly deprived population, etc., these machines work really well. They're super convenient. Our population's really bought into this, and actually at the beginning of the project, I wasn't expecting this to be anywhere as near successful as it has been. So again, credit to the people that have done the work on this. Data integration is a challenge, fully recognise that, and we want to get it done, but it shouldn't overshadow the success that I've spoken about of all those additional people accessing stop smoking services and all the other services that we're able to offer only as a result of having these machines based across the town. And as I say, I do feel this is a real life example of the integrated care system really coming together around an issue and doing something practical and deliverable, so our residents feel the difference. So that's me.
Thank you so much, Suleiman. Yeah, exactly, a fantastic example of cross-working within the ICB areas and councils. Please do pop any of your questions in the Q&A section. There should be a little icon on the top. If you would like to pop any questions in there, we can come back to them later on. I believe the next speaker is Olivia, who is going to talk to us around the work that's been going on at Beacon House.
Good morning. It's actually Michelle Wilkinson. I'm using Olivia's screen, so forgive that.
Apologies.
Hopefully, can you all see our slides? Yeah.
Not just yet, Michelle. Apologies as well. I will get your name right.
I'll keep talking whilst the slides hopefully will pop up on your screen. So a little bit of a background. I'm the advanced nurse practitioner at Beacon House. We're a primary healthcare centre in Colchester in Essex, specifically for the homeless. So we're quite a unique setting. We offer a nurse-led clinic, showers, laundry, clothing, occupational therapy, drug and alcohol support, housing, to name sort of a few things. We have approximately 30 to 50 individuals who will access our service on any given day, and we're drop-in. So we recognise that homeless people quite often are reluctant to make appointments or are unable to keep appointments. So we are just a drop-in. They don't have to, same as we've heard about Luton, using the machine is actually convenient for them. And so we noticed in the 2021 that our population were behind the times for using digital healthcare. So lots of them didn't have mobile phones, didn't know how to use the additional functionality of them, didn't have laptops, had little digital confidence. And during COVID especially, they fell really behind the curve because everything went online. And suddenly this whole population of homeless people were left stranded. So we were really passionate around that time to try and upskill them for their digital health access, and got in a digital hub point from our local council. And I guess from that is where we made contact with CISU through Anglia Academic Health Science Network. And there was this plan to put one of these wonderful machines in our foyer. So it's been in now over a year. Historically, our patients would come in, they would do a health check with myself or one of the other nurses. So we'd do blood pressure, height, weight, everything that the machine does. And then we'd unpack that, discuss options, and we'd do drug and alcohol, etc. It was a very lengthy process. And often the homeless patients would get a bit frustrated with the amount of time they were in the clinic, and actually their priorities weren't around their health. As we know, they want to find somewhere to eat, and if they've got an addiction, deal with their addiction. So we were losing patients because of that lengthy process. So when we had the CISU health machine in, it's been an absolute godsend in that the patients now come in, they straight away go on the machine. We have a volunteer helper who assists them to learn how to use it, sets them up with an email. So straight away ticking the box, we've now got them available to contact by email, which possibly they hadn't had before. They love engaging with it. They love the interactiveness of it. And it also gives them a chance to take back some ownership. A lot of things are done to homeless people, and a lot of information is that, or a lot of care that's given is dictated to them. So being able to say, I want this, I'm going to engage with it on my terms, and they've found quite liberating. The feedback has been really, in fact, lots of them are wanting to use it almost too often, and they'll come in and use it on a Monday, and then they'll come in on a Friday and say, oh, can I use that machine again? So that's how positive it's been for them. Bearing in mind, these are patients who traditionally don't access healthcare, aren't interested in these type of statistics or finding out about their height, weight, etc. So it's a really marked change. Practically, because we've had this machine, for me, it's like having an extra member of staff effectively, it's released one of my other nurses up to offer another vaccine clinic a week. So the time that we save by patients doing that part of it has enabled us to run another vaccine clinic. So it's ticking lots of boxes. Additionally, it's allowing me to target the ones where we are getting the statistics coming up. So if a patient has high blood pressure coming up on the CysU, I will actually go out and get the patient once the results are on the screen and it's been highlighted, and I will do targeted interventions with them. The data that we get, as my colleague in Luton said, is really easy to extract. It's clear graphics, it's informative. And for example, if you look at benchmarking, you can see that for high blood pressure, it says 67% also smoke in the blue box. Well, in our the national population is 30%, so it's allowed us to benchmark and show the really higher comorbidities, risks that homeless people have when we're writing grants and bid applications as well. And then on to the next slide. I think there was a mention that what happens if we get all of these high risk patients, and what do we do with that data, and what do we do with following them up? We're fortunate here. We are a prescribing clinic, so we are able to diagnose and treat. So we can offer immediate offer of statins if necessary for cholesterol, immediate smoking cessation on site. So we are a one-stop shop with this information given. And then finally, I think my last slide is a patient's experience. It's a little video that he's done for us. If we can find that. Yes, this is Dale, and this is his view of a homeless person using the CysU. Hopefully, the quality of the picture may not be good, but you should be able to hear his voice.
Right, hello, I'm Dale. I'm here today basically like homeless. Well, I was homeless, but I'm not anymore, but I'm still using Beacon House. I'm here to show you basically it's like a AI doctor sort of thing. It's basically a machine they brought in. It's basically to check like your health and stuff like this. Yeah, so I'm going to take you through that. It's like having a doctor in front of you, but the staff have helped me go through it. Yeah, like it's got each stage on there. You put your email in there, and it goes through sort of like your health, your weight. It does your BMI. It does your blood pressure on there. So if you're ever stuck and you need some help, like if you're ever worried about your health, say, yeah, it's a place to come and get it all sorted for you. Also, if you struggle with any technology, I used to struggle with washing machines until I learned. But this machine, if you don't want to go to the doctor, like say some people don't want to go to doctors or anything like that, but if you don't want to go to the doctor, come use the machine. It's so easy to use. It's self-explanatory. It's like step-by-step guide on it. If you do get stuck, the staff will help you through it. But once you've done it once, you won't need to have staff to do it again. Yeah, it'll just show you a step-by-step guide, and it's so easy. If you ever worry about your BMI, your blood pressure, it does it all for you. It's step-by-step. It's so easy.
Thank you. I feel like I should have got Dale to do the presentation, really. So going forward, there are lots of additional capabilities and functionality that the machine has that Jez has been speaking to me about. We're keen to look at how it might also do something like the PHQ-9, so the assessment for depression. So at the moment we're using it for stress, but obviously with our cohort, our patients have quite complex mental health needs. And so we need something a little bit more in depth than a stress assessment. So we're looking at possibly having the functionality to do something with depression, and then the health messages around that and where support's available. So again, signposting them on to local networks, possibly, if I don't know whether it's possible to have like the links into Samaritans or the immediate health mental health crisis cafe that we have in Colchester and Essex. But yeah, we're quite excited to look at that, and we're also talking to Jez about possible substance misuse screening. So we currently use it for alcohol screening. So we use the Audit C, which gives us a benchmark for whether they have the start of an alcohol problem. But obviously with our patients, we have a lot with drug misuse as well. So we're having those conversations about how we might expand its use to do even more work than it's doing at the moment. So it's really been transformational for Beacon House, for how it's assisted us in the clinic. That's it. Thank you so much.
Brilliant. Thank you so much, Michelle. A lovely example of reaching communities that don't always have the same way to access healthcare. And if CSU does do washing machines as well, I'm absolutely up for that. Any support there would be wonderful. And great that you are thinking ahead and you've got new things in the pipeline and how you can add on and make the service even better for that set of patients. So a fantastic presentation. Thank you. Okay, so I think our next speaker is Denise. I have seen her on the screen. So I will pass over to you, Denise, for our last case study. Thank you.
Thank you very much. So hopefully it's presenting. It's just coming up. So my name's Denise McLegg and I'm the Public Health Improvement Programme Manager at Southwark. So I work in the ICB, but I also work with our council colleagues who were the initial contractors around the CSU, the health kiosk programme as well. So we've been working very closely together. So in Southwark, so very similar to Luton, we've got a population of just over 300,000 residents. Very again, much like Luton, we've got a very young population, but we've also got a very high ethnic population. So around 49% of our population come from a Black, Asian or ethnic minority background. Similar to a lot of places in London and out of London, we've got very high health conditions, which where in Southwark we can see they're slightly more increased. So we've got significantly poor outcomes when it comes to preventable deaths, people living with mental health conditions as well. So these are a lot of the things that we as a borough are trying to work on, which fits in very nicely with the health kiosk. So Southwark itself is the 40th most deprived local authority in the country, and because of a lot of the protected characteristics that we have for our residents, we have seen a lot of poorer outcomes when it comes to CVD and other illnesses. The Vital 5 programme, which is very much around the health checks, is a very key priority in Partnership Southwark, and that's where we're kind of leading this work. And from that work, we did a discovery project, which was working with our local residents and actually testing the health kiosk in the community and actually getting our residents' feedback on how they liked it and what their experience was. So following on from this, in August last year, we commissioned 6 kiosks that are located in various different places across the borough. And in collaboration with the team, we held a multidisciplinary task and finish group so that we could actually look and review the patient journey so that it would fit within with our residents, but also making sure that in terms of where they were signposted, they were to local services and making sure the services were still available and we weren't signposting people to where they couldn't go. The aim of our programme was to have a positive impact, being able to make people aware of their Vital 5 measurements, but also around health checks as well, making a service accessible, because as we've said, a lot of people not always are going to their GPs or they just can't are not able to make appointments as well. Because we have a very high deprived area and with poorer outcomes, we felt it was a really good initiative to put out there, and being able to give people that empowerment to be able to kind of make their own their choices to go and have their health check, but also make the decisions to actually then go on to have further help in order to improve their outcomes. which fits in with a lot of the wider context around kind of the Core 20+5 programme, reducing health inequalities, etc. So what we have found is that having can't say the word, I'm sorry, health checks, so being able to put something somewhere that's accessible to people, it would, a lot more people are bound to take it up. We know that men generally will use it, younger people as well, but we've actually found that it's been different within our borough. So so for the last year, we've had over nearly 16,000 health checks completed. Around 40% of them have been repeat participants as well, which is fantastic. So people are not just coming once, they're coming repeatedly. Average age is around 35 years old. We've got a very even split of male to female ratio as well. And this is, and it does have the question that, so it's not just saying, are you a man, are you a woman? It's also how people identify as well, so that we are using the correct gender in there. We have found that obesity is our biggest risk factor in Southwark, with blood pressure being our third. Around about 19% of those that are using the health kiosk have at least one risk factor as well, which very much fits in with what we are aware of. Over 72% of them are sitting within our high deprived areas of the borough as well, and which fits in very nicely in terms of what our ethnic makeup is of the borough. We're sitting around nearly 50% of them, which is very similar to what we know our borough looks like actually using the machine as well. But we've also seen some improvements. So over 28% of the participants that have used the machine we've seen an improvement in their blood pressure as well. So there are lots and lots of benefits to it. So we have worked with our primary care, and what they have seen is that it frees up a lot of the GP time and relieves the pressure on primary care services, especially for those people that are aware of hypertension, for example, so they can go to the kiosk and have their blood pressure checked as well. We are looking at how we can incorporate it with our health checks program as well, so making it more accessible. The only thing is at the moment we don't, so we're looking into the logistics around kind of the blood tests, etc. It requires very minimal digital literacy skills, as well as the gentleman in the video at Beacon House has just showed. It's very easy to use. I've used it myself now, and people feel, and because they're in a very intimate place, people feel very comfortable in terms of using it, which when I went to one of our health kiosks, I did get some feedback from some of the residents that were using it. There has been some barriers that people have said. I think with ours, which is not very similar to the one in Luton and at Beacon House, we don't have somebody there that's able to support anybody. So we have got that missing human touch to it. So that's something that we are always going to look into. And I think it was in the video just about it, when people get results that they weren't expecting as well. So some people may feel distressed with some of the results as well. So it's just how we can look into those barriers and risks. But there are lots of opportunities as well. So as my colleagues have said in the other areas, we're looking at around accessibility, because we've got some residents who have visual impairments, so looking at how we can use headphones as well, so that people are able to still use the machine and we're not restricting it to those who are able to see. Looking at linking in with our digital and health checks and face-to-face health checks program as well. We're exploring the opportunity around the patient portal, which has been quite successful in Luton as well, and how we can have that human touch in terms of the results that come out as well, and looking at including very personalised messages around brief intervention. So if a risk factor has been identified, there can be like a one take-home message that they can start to work on, as opposed to if somebody in one of the results where they had 3 different risk factors, given that one thing, and that might then just encourage them to kind of work on that one before moving on to the rest of the 3 as well. And also including messages, so health-related messages. So if somebody who is coming up to the age of health check, just having those reminders, with it being vaccination season, having reminders of those that are eligible for their COVID and flu vaccinations, etc., and what is available in the local area, information around screening programs as well for those that are in those areas. So in terms of our patient feedback, around 71% of those that have used the kiosk would recommend them to friends and family, which is absolutely fantastic. And we're looking to develop a more kind of comprehensive feedback, which would just kind of help us to understand the reasons why people initially went to use it, what's happening after, what health behaviours have changed since they've used it, what actions they've taken, and then just around their motivation, capability, etc. So what's next for us? So we have continued our programme with using the health kiosk, so we want to keep it within Southwark. We're developing our comms and marketing plan in order how we can promote it more widely as well. We're looking at doing an evaluation of it and exploring a lot more in terms of our opportunities and improvements that we've looked at, we've identified so far, that we can optimise the use of the health kiosk around the borough, and looking at locations as well. So I have had discussions with Jez and Rob since I've started taking over the project about how if we can use like a rotating location for one of our kiosks, so having it moving around the borough, so every few months that it's in one place, but it's communicated to our residents that they can go to a different part of the borough, so that we're not restricting, and for those that are living in an area where there isn't a kiosk that's near, it will come to them at some point during the year. So that's where we are at the moment. Thank you very much.
Fantastic. Thank you so much, Denise. Another amazing presentation. Really nice to hear such varied examples as well across the region around the same technology. So really good to hear. I'm going to pass over to Samantha and also Nick Clark, my colleague at Health Innovation East, and Samantha, CEO of CSU Health. We have some questions in the chat, so I am just going to get those up. Please do post anything for any of our speakers today, or the CSU team, in the chat box. Hopefully you should be able to access that. Right, let me just find the first one, because there was quite a few in here. So we have right, this is from anonymous from the group. Great presentations, thank you all. So Jez mentioned that 36% of CSU users had a health issue, which is a large percentage. Is CSU used for annual reviews for people already with a diagnosis? So, for example, secondary prevention.
Shall I take that one? Thank you, Jenny. And
yes.
Thank you for the question. So look, the CSU health stations are used in a real variety of use cases. We've heard much more today about the opportunistic cases of placing them in community locations. Many of those users are first-time users, but as Denise said, in Southwark, for example, we're getting lots of repeat users. Some of those will be coming off their own interest and wanting to track their own health. Some will actually be getting direction. So we have seen examples, for example, where GPs are actually suggesting to people who may have gone recently onto blood pressure medication that rather than sort of come back to the GP on a regular basis, they can access the CSU health station just to keep that ongoing track of their blood pressure. We've seen that in other regions as well. So not being done on a formal basis, but certainly being done on an informal basis. However, there's absolutely the potential that CSU health stations can be placed in GP surgeries, pharmacies, as well as other locations to be used absolutely in that secondary prevention instance as well.
Wonderful, thank you, Samantha. Right, second question. Really interested, so this person, another anonymous, really interested in the example from Suleiman, as it requires a strong cross-team working. So this maybe is directly at you, Suleiman, but absolutely do step in, Samantha, if you have additions to this. Where do you see the next step considering integration issues? So I'm assuming they're thinking about patient sort of electronic records, etc.
I think it's probably a bit of the technical and probably a bit of the ICB, isn't it, Suleiman? Do you want to take the ICB context perhaps, and I'll take the technical context?
Yeah, can do. I think there's an addition. So sorry, let me just take that back a little bit. I think there's an additional thing. So when we started this, so we've got a population of 225,000 people, and what I said to Christina was, what would it take for us to get a blood pressure in the last 12 months of our 225,000 residents? So taking out whenever we get 100%, I think it's about the scale. So part of this is about the scale in order to achieve the reduction in cardiovascular disease prevention that we need. So for me, my next step, I think, is about understanding what the scale required is to have a real impact at a population level. As Samantha said, I think the big thing we're getting pushed at from our health colleagues, rightfully so, is around the data integration. So that's a conversation that we need to have internally. But I think it's about recognising this has a much bigger role within the CVD prevention strategy than I appreciated before. Samantha?
Yeah, and I think, look, it's a common theme across all of the case studies that we've heard today, is that all of those stakeholders in all of those areas are working in a really integrated and collaborative fashion across the boroughs, across the ICBs, and also, with the CSU health team as well. So I think there is already really great integration. From a technical integration perspective, that's a piece of work that's ongoing. Every sort of borough, every GP, every ICB has a slightly different integration requirement. So we're looking at that locally with each sort of partner group and in each region, because there will be slightly different needs from a technology perspective, but also, of course, really important to involve our GPs and some of the wider healthcare stakeholders on the workflows and the various sort of triggers and pathways that are involved in that as well.
Fantastic. And I can see Olivia's sort of added on to that point around the case study. Sorry, it's not Olivia, it's Michelle. I keep getting tripped up by your digital second identity. So another point around the population that Michelle's working with, obviously there's a homeless population, and they're often transient and moving from town to town with no registered GP. So the CSU allows them to carry that data with them and check in within another town if they move location. So yeah, a really good point that it sort of gives them control over their own data as well.
Yeah, no, that's a great point. So everybody has their own data. They can choose to share it with their GP or other health professional themselves through various mechanisms of extracting it out of the web portal or the app, as well as the practitioner portal that we've heard of. But I think we're looking then again at sort of further integration as well back into the GPs and patient records. So there's already a lot of opportunities to share the data. You're quite right.
Absolutely. I think it's a challenge for all digital solutions in this space, is trying to integrate with all the varying systems that different organisations have. Right, I think I missed another question in here. So this is for the CSU team. Where do you envisage that the latest model of the more mobile / movable CSU will be used? So is it workplaces or other areas?
So it has a number of different use cases. So, for example, where it's being used at the moment, it's being sent out to really remote locations where perhaps logistically sending out the larger health kiosk wouldn't be appropriate. And for example, it can be sent in the post, it can be put in the back of a car. It's been used on oil rigs, where again, that's a very sort of easy use case. So where we see it essentially is that anywhere where it's not appropriate for the larger health station does have additional benefits of being really visible, being really robust. But where it's not practical, the mini health station can be used to reach those either more remote or more socially excluded for reasons of sort of practicality. It can also be carried around by a health professional. It's sort of everything in one. So, the nurse can put it in the back of their car. It can be moved around in some of these mobile bus sort of health check sort of options as well. So lots of places really that it can be used. You want to add to that, Nick?
No, it was a bit of a separate point actually. So I think the mobile version, though, as you clearly have kind of summarised, will have huge impact. And I guess leading into the question that I was going to add, it's yet another example of how you're looking at diversifying with regards to demographic need and how things like people being in remote locations, for example, it's really important that things like community wellness buses and stuff can carry these to kind of those more remote areas and benefit from the technology as well. My question was sort of linked to that, but was directly to Michelle. And I think it was just such a powerful presentation and case study with regards to, again, looking at the different demographic and inequalities agenda. And I think you touched on workforce as well with regards to like how much it's freeing up staff to do other kind of routine services and how you can diversify again to look at things like substance and alcohol misuse. I guess my question is about sustainability for you, Michelle, with regards to clearly there's a huge impact that this is having. How do you generate the business case in order to kind of sustain that technology, and how can you share that with similar charities so they can benefit too?
That's a good question, Nick. I guess as with most charities and models, we are going to have to use the data that we're getting from GES to generate that business case. We've already had a couple of bids gone in. We're trying to speak to the ICB about it and PHE, especially to do with the vaccines and the fact we've enabled time to come up for vaccines because of having the machine. But yeah, like most charities, it's bid writing and grant finding. So if you've got any ideas, let me know.
Yeah, and absolutely, we'll continue to support you. And I think that's a really good point, actually, with the role of the Health Innovation Networks and Health Innovation East. You know, we are here as that kind of convener, facilitator to help join up some of those conversations and help to empower charities to use data to make the cases. So absolutely, we'll continue to work with you on that.
Wonderful. I don't think we have any further questions. Is there any other comments from any of our speakers before we close? No.
No, just to thank you to the company and to the presenters. I mean, this has got some great achievements, but also further huge potential.
Yeah, and especially from us as well. Huge thank you to Southwark, to Luton and to Beacon House today for taking the time out to join us and to tell everybody about their experiences. We know that takes effort, and we're really, really appreciative.
Absolutely, yeah, it's a great example of bringing everyone together, and really glad that we could help bring this to life. So as I mentioned, this webinar has been recorded, so we are hoping to share that with delegates and any delegates who signed up but were unable to make it today, and we will also be sharing any contact details. So if you have had any issues asking questions, by all means do get back in touch with us and we can pass them on to the CC team. Right, well, if that is everything from everyone, I will wish you all a very good afternoon. Thank you very much for coming, and yeah, please do get in touch. Thank you.
Thank you so much, Jenny, for organising. Thank you, Innovation.
Bye.